After shoulder replacement surgery, your doctor will decide which type of sling you will wear, and they will decide how long you will need to wear it. After surgery, you will wear your immobilizer at all times except for showering, dressing, and performing your therapy exercises. The majority of surgeons use what is called a shoulder abduction splint or shoulder immobilizer. You will wake up from surgery with it already on. It has two long straps, one that goes over and across your neck, and one that goes around your waist. On the sling portion, you will have 3 Velcro straps, one that goes around your thumb, one that closes the front of the sling with the receiving end of the buckle attached, and one that goes across the middle of the sling. To take the shoulder immobilizer off, you will start with the strap that goes around your waist. There is a buckle in the front that you will press like a button. Next, you will remove the strap that goes over your neck. You can either loosen the Velcro and take the strap over your head, or you can unclasp the buckle at the front. Next, you will remove the Velcro straps on the sling and attach them to the wedge pillow so they do not get caught while you are removing your immobilizer. Last, carefully pull the back of the sling down over your elbow and carefully pull the immobilizer forward and slightly down until it is completely away from your body.